Thank you for joining us for our connected webinar on mental health and construction. My name is Kenny Leon with the Canadian Construction Association. Before we begin, may I kindly ask you to type, for the attendees here, to type your questions in the chat box that you see on the GoToWebinar panel, and we will actually answer them at the end of the presentation. So that way you have an opportunity to ask the questions right throughout, and then we will answer them at the Q&A session. Today's webinar is actually presented by our long-standing member Ledcor Group with the support of the Canadian Psychiatric Association. On the call today, I also have, in addition to Dr. Ashley Brender, who's going to be the presenter today, I also have David Hoff, Senior Vice President, Corporate Communications and Public Affairs at Ledcor Group. So I'll let David say a few words of a fantastic initiative that they have as well, or they're part of, and over to you, David.
Thank you very much, Ken, and welcome, Dr. Bender. We're very proud to be part of supporting this session. Ledcor has been a long-time supporter of the CCA, including its annual conference, and we're very pleased that our sponsorship of the annual conference was shifted over to this event. Like many construction companies, very active on health and safety and issues. One thing that we have done in Ledcor is a little bit different than others. We've been quite active in mental health. We have, for example, been a long-time contributor to the Kids Health Phone, and some of you may have learned more about that organization in recent weeks when the Prime Minister Trudeau announced a donation and the tens of millions of dollars to Kids Health Phone to help kids and youth through this COVID situation as well. And one other thing I might just quickly mention is the tool that's available to everybody. Ledcor is one of many companies that were joined together by Morneau, Chappelle, and those companies include like Canada Life, Sun Life, Bell, RBC, Royal Bank, Air Canada, etc., that have supported a tool, an app that you can download through Apple or Google Android onto your phone, which gives you a quick assessment of your mental health. It's free, and it's called WellCan, WELLCN, and there's also a website, but it's something, again, to in this time of isolation, if people want to do a quick check on themselves or another individual in their circle, they can use that tool. So again, we're involved with those initiatives, but we're here to get more substantive information and advice from a professional. So we're glad to participate in this, and I'll turn it back to you, Ken and Dr. Bender. Thank you very much for letting us participate.
Thank you, David. Thank you for your continuous support, both for CCA and also for the programs that you actually host, especially on the mental health part of it. Promoting sound mental health in the construction industry not only has the potential to save lives, it just makes very good business sense. And I think, as David explained, that was a wise decision for Ledcor to be actually be able to participate in that as well. And sometimes it doesn't take months of planning or prohibitive expenses just to launch a program or to kind of be. So our goal today is to create that awareness, see what actually needs. So we are pleased to welcome again our presenter, Dr. Ashley Bender, with us. Dr. Bender is an occupational psychiatrist and assistant professor with the Faculty of Medicine at the University of Toronto. He is also staff psychiatrist at the Center for Addiction and Mental Health and former medical head of the Work, Stress and Health Program, which is a multidisciplinary program specializing in the assessment, treatment, and research of occupational disability. Dr. Bender has several publications in the area of workplace mental health and has conducted research focused on the management of psychological injury in the workplace. He has performed numerous independent assessments for workers' compensation, private insurers, employers, and the courts, and provides workplace consultation and training as co-founder of Workplace Insight. Over to you, Dr. Bender.
Great, thanks for the intro, Kenny. It's always great to hear it, especially because I wrote that, but nonetheless, thank you so much. So I'm gonna just shut off my webcam as well. I know we've got a lot of content. My goal is not to inundate you with facts or information. Most of the people here are well ensconced in this issue and are here because they actually care about it and want to do something about it, like myself. The idea is for us to come away with some strategies and hopefully get some standards emerging within the construction industry as well. Okay. So I'm just going to go through what we want to cover today is a couple of things. Is focus on this issue of psychological injury at work. Traditionally, within construction or many industries, there was back injuries and other factors got most of the attention. And I think in this much more sophisticated work environment, this is really understanding the role of mental health as well in its place. And hopefully to encourage you to invest in this area, because the return on investment is really immense, and anywhere from 4 to 6 to 1. So every dollar you put in, you're going to get 4 to 6 out. So why now? Why do people care about mental illness? And I think one of the biggest studies has been the global burden of disease study done by the World Health Organization. And this really put mental disorders at the top of the list of issues that are affecting workforces, not just in Western economies, but now across the world. And a lot of this transformation has happened as we've shifted from this brawn to a brain economy as well, and the importance of technical skills. If you look at those illnesses, if you look at mental disorders, you're really not focused on severe and persistent mental illness that people traditionally think about, schizophrenia. We're really talking about the trinity here. It's depressive disorders, anxiety disorders, and substance use disorders, including alcohol. So if you're looking at this chart, this is anywhere from 12 o'clock to 9 o'clock. So 75% of the mental health burden is a result of common mental illnesses that affect us all, our loved ones, our friends, and our family. You don't have to look that far. And if you look at some of the stats, we know that by the time someone's age 40, that half of people have been affected by that. And I think that speaks true to anyone's personal experience as well. So the other part, when we're going to look at mental health within a workplace setting, we need to really have a broader view of what it is. I mean, the WHO defines mental health as the ability to cope with everyday stressors, to reach your potential, to be productive at work, and to contribute to society here. And if you look at, if we look at Canada, we're seeing a lot of societal changes around attitudes towards mental health. You're seeing changes to human rights legislation that have been updated. And now within organizations, we're seeing that translate into really proactive policy practices and putting some money behind it to actually get the outcomes that affect their individual workers here as well. So as we go through this, I want you to think around the factors at play and how that may impact how you make decisions around that affect your organization, and also of those who work directly with individuals or workers that are affected, what they need to know and where they need to go in order to get the help they need. So why is it important to construction? And if you think about it as an industry, most construction workers are 18 to 55, with the most significant 2/3 of workers being 45 or under. It's at this time predominantly male, well over 80% in many industries as well. And that brings special challenges. So we see much higher rates of substance use disorders impacting their contribution to accidents or injuries that happen in the workplace. There's many adverse conditions in construction by virtue of being in Canada, being outdoors, but also it's very vulnerable to economic factors. And I know when COVID, the first thought is what's going to happen to my industry and how's it going to be decimated? This is an example of how precarious employment can be a substantial contributor to mental health as well. And we're really seeing this manifested in substance use, gambling, other high-risk things, violence, and of course suicide and serious injury as well. these are not unique to all workplaces, but very significant in construction. If you're at the other end, on the HR end or the leadership end, you may be seeing some of your data coming through. A lot of people keep an eye on workers' compensation claims, but also serious damage being happened, the ability to range good staff. And the other, I think the key parts that seem to mobilize individuals on wanting to address workplace mental health are human rights complaints, either for discrimination and other factors, and of course, fatalities as well. So we're just going to come into a case here to illuminate some of these factors as well. So Xavier has actually been a full-time foreman for a number of years, go-to person, always been reliable. And what happens, he has a new apprentice on who ends up getting seriously injured in a crush injury incident, which unfortunately happen all too often. He's first on the scene, he's trained in first aid as well, but then shortly thereafter really learns this individual is not returning as well. Xavier's not telling you the full story, but what other people say are the common things. He's not his usual self, and what's more apparent, he's not coming to work as expected. So like any good manager or employer, you reach out and you get occupational health words like stress. I'm worried about the apprentice, their family, feelings of guilt. And the response is one of anger. There needs to be some real changes at work. So if you're on the employer side, what does this actually mean? What needs to be done in these kind of situations? And this is really a litmus test of problems and a cue to perhaps respond to his concerns. So one of the first things I think actions that employers have is taking on this issue around stigma. So stigma, you know, loosely it really goes down to core attitudes and beliefs that lead to people with certain condition, in this case mental health, being treated or looked upon differently than others as well. Often in these situations, self-stigma is the strongest and doesn't necessarily echo the values of an organization, but it's a powerful thing. History is really responsible for this as well. I know even as going into medical school, so I graduated in '99, people laughed or snickered because I was one of 2 people from the class of 100 going into psychiatry as well. And you could see it. I mean, psychiatry had its dark path of invasive procedures, asylum. And what you've seen happen over the last 50 years is modern pharmacology leading to the end of institutionalization, to something over the past 20 years that's much more sophisticated in approaching this as a diseases and illnesses like heart disease or cancer, understanding genetics, novel therapies as well. And now the science is really there. It's only in the past 10 years that we're really starting to catch up to this within a workplace setting. So you saw national guidelines around psychological safety, and then most recently the Human Rights Code that said, hey, you cannot discriminate in a workplace setting. So what are the key parts? I think if you look in construction, and I've done work in policing as well, there are some pervasive attitudes that play by virtue of being male predominated, depending on people's personal experiences. Each organization is going to have core attitudes that may be helpful or unhelpful in addressing mental health. What I suggest in a lot of cases is finding your champion. You know, someone like David, who's here leading, that's really decided to make this own for the organization. That's an example around mental health leadership. And within each organization, whether how small or large you are, identifying a mental health champion, someone in a leadership position that's respected, that may hold this dear to them, may have shared their personal experiences, but also takes personal responsibility in overseeing the sustainability of these programs. Stigma can also happen, indirectly in many ways. One is not enforcing policies and procedures. Fine, it's one thing to have it on paper, but not following through. Things like the rumor mill, managers blowing confidentiality as well, do a lot to say, hey, you should be ashamed of your mental health issues, and differences in the way your willingness to accommodate and support individuals who have been psychologically injured compared to being physically injured either will go on to perpetuate stigma, negative attitudes and beliefs. So these are really 4 strategies to say, hey, have we got a fair policy? Do we back behind it? And who's our person out in front to make sure that any deficits in this are addressed promptly? So we're really here is, I think one of the key parts is, we talked about attitude, is also recognizing that people are at risk for psychological injury, just like physical injury. There's been a ton of work on workers' compensation around safe workplaces, modernization, and I think we're getting there from a psychological point of view as well. It's just really starting here. Now, most of the time, if we were 20 years ago, whatever happens at home stays at home. You come here to work, I don't want to hear about it. Now we're really recognizing that employers do have a responsibility to acknowledge potential for psychological injury and the impact of things like critical incident exposure. This was a big factor in policing, emergency services as well, healthcare. And I think if you look broadly across transportation, construction, all sorts of sectors, that these things are ubiquitous across the board as well. So what are the factors that are associated with psychological injury? So one is this idea around job strain coming from a discordance between the amount of demands you put on someone and the amount of control and support that's available to you. So if you have a job you hate, a micromanaging, controlling boss, you hate your spouse, and you have no friends, that's an example of someone who's set up for high job strain. That's a rare thing. I think the reality of all of us are dealing with, and particularly in construction, is high amounts of deadlines that involve high job pressure. There's a lot of oversight and not a lot of control for the individual worker. Now, what you see high job strain is not manifesting overtly as mental health problems. Sometimes you're seeing that addressed as behaviors. So we're seeing this come out with hostility, high emotionality coming at work as well. We see that it also contributes directly to unhealthy behaviors like alcohol and tobacco use. And what I'm always amazed, and when you go by a construction site, the smoking rates are apparently much higher than you would see in other professions. Is that a culturally acceptable as it happened to outdoor spaces, but also could be a manifestation of unhealthy coping? This ultimately leads to not only physical injury from accidents, but also psychological injury. What you'll see from a worker side, you get unionized environments, a lot of rallying focus around issues of remuneration as well in response to high job strain, poor recognition, but in response to that, looking at job strain in this model between effort, reward, and balance, actually increasing supports from your workers, recognition, anti-discrimination strategies, and anti-stigma strategies actually do reduce people's experience and perceptions of job strain within their workplace as well. So this is really one way to address the pendulum that doesn't necessarily lead to increased costs in the short term as well, and maybe something you want to bring to the table next time you're bargaining at the unit. The other thing is really taking head on around issues with bullying or harassment as well. Quintessential example here, I make no names, it's just a picture as well. But in a male-predominated environment, I know it's one of the Canadian Construction Association's agendas to improve inclusiveness and diversity within that group. Those are often the higher risk and more likely to be targets of bullying, harassment, and discrimination, which ultimately can lead to psychological injury and problematic things like human rights complaints, increased long-term disability leaves, staffing problems, and quite frankly, long-term competitiveness issues as well. The other part I want to really address on is recognizing the substantial impact to suicide. This is a mobilizing part. There was a study done through the Center for Disease Control, this is in 2018, that looked at suicide rates in construction, and they were 3 times the general population in general. So, you know, they'll look at numbers between 50 per 100,000 people instead of the typical 14 to 18 per 100,000. If you look even amongst that same group, male, the younger age group as well, it was even proportionally higher in construction itself. So there's something about the environment. You know, one of the factors that came into play was access to heights as a means to hurting themselves. And that was very similar to the issue that came up with policing around access to weapons as well. You know, I wasn't, believe it or not, I was not born a shrink here as well. And I think one of the things that reasons I got into this was we had a family business, and my brother might even be watching this, concrete manufacturing as well, and worked many summers there, knew all the staff. It had grown to be a successful, you know, small, medium-sized business. And I remember being in my first year of residency and getting a call from my dad on the phone. And, you know, he's a burly, hairy Mennonite guy who doesn't show a lot of those kind of vulnerable emotions, and just crying on the phone. I'm like, Dad, what's going on? And he's like, there's been, you know, Johnny's died at work. And I'm like, what? How did this happen? And this was a young staff or new worker who was the son of one of our long-term employees. And I guess a new crew came in, and they had, you know, turned on one of the batch mixers to start the next shift. And lo and behold, Johnny was in the batch mixer. How could this happen? The sense of disbelief, pain and guilt, not only experienced by the family, but the owners and everyone around it, was substantial. And as we started to go through from the investigation, you know, you learn more that Johnny had got into some legal problems, was supposed to see a lawyer that day. We'll never know exactly what happened, but the more they piece it together, it was likely a suicide in this case. What we do know is the follow-up of that incident was substantial, and this is 20 years ago as well. Not only are the Ministry of Labor investigations, hey, you got to put a safety on a safety on a safety, those kind of things, but the impact on the family. But that plant did not reach the same production numbers for a year. And so these kind of catastrophic incidents, if not anticipated and not putting together a program to address it, can really have lasting impacts on your organization as well, and should be a mobilizing factor. It's the #1 reason that I get contacted as a consultant. So let's carry on and think about how we address this. So policing had to really recognize this issue around high suicide rates was what brought them to the table, then also recognizing the tremendous impact of psychological injuries for first responders. So we actually worked with the Ministry of Labor and put together a first responder first toolkit. I encourage you as an employer to visit this site, and it really puts together what are the core tenets of a mental health strategy as well. There's an inventory that can help you to gather gaps that you may have in your organization. It's PTSD focused, but the reality is that if putting the strategies in place that in the First Responder First program is going to help address the things that affect most people: trauma, depression, anxiety, substance use as well. And I encourage you to check this out. And it also has a great list of resources and self-assessment tools as well. So how do you get ready to address mental health? We talked around some of the knowledge, addressing stigma as well, but the other is training, right? And training is such a key part. There's some people that very naturally will take on these issues, but one of the key parts, we talked around, Xavier knew first aid, he knew CPR and the tenets of resuscitation, but there's also additional training around psychological first aid. This allows people trained either on your crew or within your organization that can respond to employees that are in crisis as well. Traditionally, people might have called in their EAP and had, if there was a death at work, bringing in the external responder. But I think that people can be trained in first aid and respond in a supportive, consistent way that an individual feels like their organization cares right from the beginning. And those kind of experiences crystallize their experiences first on and makes them much more likely to come back and return to their employer after they've recovered from their injury as well. This is available, for example, Queen's has Mental Health Commission of Canada offers first aid training courses. I would definitely put this on the list. The other part is your supervisor, anyone in a leadership position, either on site within your organization, getting some key training around mental health as well. There's a mental health leadership training offered through Queen's, but you gotta have key people. And it's very straightforward. People can learn how to have those crucial conversations, documenting performance issues, but also approaching performance issues with the possibility that there could be health-related issues that are driving the performance problems, just like this case. The other part is they need to have knowledge of resources, where people can go to help, rather than just flipping the card and say, oh, here's the EAP. Sometimes people are expecting things more sophisticated or broad than that. The other part, I'm again emphasizing confidentiality. I can tell within organizations, so I do a lot of work within hospitals, the units that have good managers see much lower rates of workers' compensation claims. They also find they're much more successful in accommodating employees. And quite frankly, the employees are much more willing to come back after a long-term disability claim. The other key part and key step here I'd encourage you to do is get a workplace peer support program in place. If you're looking at one action item, this is often received quite well. There's guidelines for training this. Usually it's informal, but if you, at your next joint occupational health and safety committee, say, hey, we want to put a peer support program, is anyone in support of that? I think you're going to find the hands go up and the volunteers will come forward, but they need training around confidentiality. Often these individuals may have had their own personal experiences that they need to make sure they're setting boundaries in it, and also respecting, not getting him pulled in too much, where they're the one that's calling at midnight to ensure they're not suicidal, their coworkers not suicidal, instead of them being connected with a skilled and trained healthcare provider. So in Xavier's case, the right thing was really to reach out with them. But again, it was the peer support worker was the one that really connected with him. They had the trust and the rapport because they had worked together on other crews in the past. This was, the peer support said, hey, you need to have this conversation with the manager, and the manager was the one that said, hey, I'm concerned that something may have happened when you responded to the incident with your apprentice, you need to go get medical help. Not only see EAP, but check in with your family doctor, makes everything okay. It's often that point of contact with the healthcare provider that you're unmasking more serious issues like alcohol use problems, post-traumatic stress disorder, or an aggravation of a long-standing mental health issue that had no impact on their ability to work till now as well. So getting people to guide, so that needs to be in your protocol. Often easier said than done in getting people to effective care. There's substantial barriers to accessing care, particularly now in the COVID situation. We're seeing that come through. But it's not always resources. Sometimes it's people's awareness and willingness to recognize their health issues. So being told directly, I'm concerned about your mental health, you need to seek care. Making sure stigma isn't available, but also increasing the amount of resources that are available to you. So we'll go through and think about what's available. For larger organizations, I'm encouraging you to take advantage of your occupational health department as well. Within the federal government, we just did a strategy where we revamped their occupational health department to help them effectively screen for mental illness in people that were making visits to the department. They really had a dated approach and felt it wasn't addressing the #1 issue within their organization as well. So is your occupational health department actually ready and trained to screen people for mental illness, and even identifying potential health issues and making the recommendation for treatment substantially improve the likelihood they got treatment and return to work? Again, a cost-effective part, you may flag that as, hey, we need to look at our OC health department and make sure it's not just the one good nurse that's taking on all these tough cases. We need to standardize this across the board. And is it reasonable that our HR person is also serving as an occupational health individual? Does that put them in a conflicting role when the goal is for people to come forward around their mental health issues? David had talked about this idea of self-screening. There's web-based, app-based has really exploded in the past couple of years as well. It's accessible. It fits with the younger working population. Let's face it, they're very comfortable with the modality. What happens is it really uses standardized, validated questionnaires. It gives you a feedback of the probability you may be experiencing an illness or disease, and gives you a printout or something you can share with your healthcare provider that allows that to be a focus of your interaction with the family doctor. And it actually leads to higher rates of diagnosis, proper diagnosis, and the likelihood that they get appropriate treatment. So this has been well studied within family practice models. Do you have a mental health awareness day? Say, hey guys, this is time for self-screening. And we want everyone to self-screen themselves. Take the time out of the workday today for our self-screener, just like you do your annual checkup, hearing tests, or all sorts of other screening issues that you might have within a construction or occupational health setting. The other key part I really want you to think around EA is your benefits in this case. So we talked around, there's very good return on investment for investing in benefits. A lot of people will look to EAPs as that solution. Hey, we have that in place, we got it covered. But what I want you to be aware is that EAPs are often short-term solution focused. So individuals are getting 4 to 6 sessions of care or counseling, which isn't necessarily aligned with the kind of treatment that individuals need who have major depressive disorder, anxiety disorder, or substance use disorder. It's a start, it's often a segue, but people need to have access to more robust care. So you're seeing a lot of employers choose within their benefits package to say, hey, do we really need to make orthotics available to everyone? A lot of the traditional physical-based physical-based benefits, can we look at the pool of money we have and say it makes sense to invest more in benefits for psychological issues? So making $2,000 a year available for cognitive behavioral therapy. If people are using it, they're going to benefit from it. There's also some really neat programs such as the Mind Beacon program, which is for $800 a year. They're providing evidence-based treatment using a mixed modality of app-based direct time with a psychologist and self-guided therapy as well, cost effective. The other is medication formularies. Individuals might align their formulary with Canadian pension plan or disability plan. You do not have a disabled work population. You have a young, generally healthy population that needs formularies that's appropriate for them. And the key part, I think, in addictions is how robust, construction is how robust are your addictions resources. It's not just about residential care. Sometimes that isn't necessary if people have proper outpatient programming available to them, enhanced resources, but also paying for aftercare and monitoring after people get back to work. There are private providers all across the country where you're getting the most bang for your buck because you're really preventing relapse. And the last part I'd say, is there alignment between your short-term disability practices and long-term disability? It can't just be around wage replacement. The intervention really should start during the short-term disability stage and be expected to continue through long-term disability. So it turned out Xavier had a number of issues that he was dealing with. He had developed trauma-related symptoms as being the first responder to his apprentice. He had also developed some substance use issues with drinking as a coping strategy. And it was really, once he got connected with a psychologist involved with his family doctor, he did remarkably well. This is a precarious part. He's 3 months off. Is he ready to go back? Is there policies? Is he ready to come back? And how do you welcome someone back who's been gone that long? Think about all the changes that happen in the workplace, people who've gone off for various reasons who are returning now, what the challenges may be ahead of them. So really the key words is the operating supportive and flexible. I think what's different around mental illness, the way it affects people, it affects everyone differently. So there has to be a willingness to take an individualized approach with some of these as well. Anytime I see unsuccessful return to work is when employers are digging in their heels about an issue. Even though it's frustrating and time consuming, having an approach that's fair and standardized but considers the individual is likely to be more successful. The Institute for Work and Health, which is here in Toronto, but is certainly one of the think tanks, has some standardized approaches, and you can see how these apply not only to physical injuries but also to psychological injuries. So demonstrating that commitment through anti-stigma, peer support, all those factors are key. A willingness to accommodate and to support that coworker through a coordinated return to work plan is really key as well. And then the other part is keeping the lines of communication. Someone, once they're back, make sure that there's clear communication between the employer and their healthcare provider so that there's modification made available. So I encourage you to say, are these principles of return to work, do we really have these ensconced with our policies and practices here as well? This is a great anchor. And then as we kind of approach the end, with mental health issues, it's challenging. So what I always remind people, and we do lots of occupational health case review, what's really the just way to approach this? If you have to break someone, if you dig in your heels and it's only after it's gone to human rights that you finally do fair accommodation, you've lost your opportunity here. If it's become hostile or maltreatment. So this idea of organizational justice, I think is a core fabric that can withhold some of the stress that comes on your organization from the burden of mental health as well. So I think always remind, are we being fair in our approaches here as well, and looking at through a human rights lens. So how do you know if you're effective? Let's say you've taken some of these strategies, and what I encourage you to do is pick one project, one area, decide on what your pre-measures are and what your post-measures are to see if you're actually getting some outcomes. You know, direct data is easier to measure, right? And the metrics may come through, but may not always be broadly evident immediately in like a quarter or 2 quarters within the work year as well. The other thing I encourage you to do is consider some of this indirect data that can be available to you. People do worker engagement surveys. What's the feeling, the grassroots feeling around morale? Are we getting less complaints? Are we getting the right kind of hiring? And what you're seeing now is employers that are adopting progressive approaches to managing mental health are seen as leaders and are attracting the brightest and youngest talent. Now, I want to leave time for questioning. These are some of the great resources that I encourage you to connect with as well. I can always make these lists available through Kenny if he wants to pass that along. But there's tons of resources in here on how to guide you through. And again, I encourage you to share amongst yourself who have been the leaders and learn from each other what's been successful and what's been not. And at the end, this is really about taking the risk to invest in this, because I think the long-term gains are tremendous.
Thank you.
So I think we got
sorry, go ahead.
time, Kenny.
Yes, and those in the audience, if you have questions, please do send them out as well. There was few questions that was there, and one of the questions that we actually had was right at the beginning. And by the way, Doctor, thank you for sharing some of the personal stories as well with us this afternoon. One of the questions that was on the slide that you actually had at the beginning, which was in the pie chart that actually showed some stats. We had a question, is there any recent studies that changed that pie chart that you showed, or is that something that's still, the picture is still the same, or things have changed around?
Yeah.
Yes.
So actually what you're seeing, so a couple of trends. One is the ratio is fairly similar, with depressive disorders being the most substantial here that you see in the blue, anxiety being the chunk. There's a couple of things that is happening. You're seeing that depression is a 2018 major depressive disorder was recognized as the most disabling illness in the world. So it, within working adults, surpassed heart disease, injuries, and other factors. So we're seeing a relative growth. And like we had said, this economic transformation and reliance on technology and cognitive skills has really highlighted that. But the relative ratio is similar across the board, and people are people. Alcohol may not be predominant in one area, but then you'll see substance use in the other. Middle East don't drink, but prescription medication use and abuse is very high within that area as well. So that's been stable, that ratio.
Thank you, Doctor. Another one that we had was to say, is there any, any recommendations of any resources related to workplace peer support that you can actually recommend?
Yeah, so there's so a couple of things. So the Mental Health Commission of Canada has some examples of what are the tenets on peer support as well. I haven't done a project. There's a oh, I'm just blanking on his name. There is a couple of groups that can help you. Stefan Grenier is, for example, he's a former military leader as well. One of his goals is putting in peer support programs within workplaces. So if you're looking for someone, there are consultants you can hire through that. He's connected with the Mental Health Commission of Canada as well. So there are a number of consulting groups that can help you do that. The peer support, I'd say, really has to be individualized because every organization is different from geography, structure, the way they're set up. They did an example that has a great peer support that I put in place was Orange Air. So we did a project with them where they greatly expanded their peer support because it was really one person that was going around helping everyone, and he burnt out. Whereas they decided we needed a much broader peer support strategy. So I can forward a list of some organizations if that's helpful as well.
Thank you, Doctor. And I was just, this is something personally from me as well, and I was just looking at some stats as well. And one of the alarming things that I found out was that suicide rates for people in construction are actually 3 times higher in the US than the national average. And something interesting, in Australia and the United Kingdom, the suicide rates there is 2 and 3 times higher, respectively, for the construction worker itself. So that's quite an alarming to see across the world, almost this trend actually being there. I'm just going to ask in terms from an industry perspective, or from an employer perspective, as much as it's creating awareness and all of that, and of course having those tools and some of the tips that you gave, is there anything else that we can do to move the needle as collectively?
Yeah, so I think a couple of parts that happen is we see suicide often results of people that die from suicide. Well over 90% have a mental illness identified. Often it's a depressive disorder in this case. So if they do post-mortem kind of psychological autopsies, and it's often untreated, or they're early in the treatment course as well. So one is by promoting awareness and treatment seeking is one of the ways to reduce the risk. The other factor, I think, in construction are a couple of things. The prevalence of substance use, because we know that intoxication, substance use problems independently is an increased risk. It's higher in a group that's already at risk, male, and generally of younger age. There's spikes around the 15 to 24, and then it spikes again in the 40 to 45 range. That's really the core group. So you've got a high risk group. So addressing substance use head on. If there's having people within your workforce who can respond to an employee they suspect it's in crisis is one part. The other part is heights was identified as a big risk factor. So building, construction, and that was one of the most common ways that people had died from suicide. Is there some degree of screening that should happen for people that you know that are going on the ground or working at heights? Hey, I want to make sure that you don't have any vestibular or balance problems, but at the same time, just being mindful, we need to think around their risk for suicide. But I think ultimately you're not going to prevent all these incidents, but having these core strategies in place, you're likely to see some reduction in that as well.
On that same note, Doctor, I think you said as much as it's an individual awareness for each and every one of us, should there be organization, especially in an organization itself, should we have champions for, I'm just looking at the practical side of things of seeing how best we can actually have make people aware. As much as individual awareness, does it help to have a mental awareness champion in the offices itself? Does it practically, have you seen anything in that which is contributing positively towards an organization change?
Absolutely. I really, like if you're thinking, so there's a couple ways. You'll see things percolate from the grassroots, and this is where peer support is a great grassroots change as well that's happened. when you have a person of senior status within an organization, I'm talking a VP or a CEO or someone of influence, share their stories, it says a couple of things. Hey, it's safe to talk about it, that it's okay. This is part of our culture where we talk around all health issues. And number two, it says you can get promoted. It's safe to talk about it, and we will respect that you have value within this organization as well. So that's one of the things. I've seen at KPMG, which is a very large accounting firm. They had a mental health champion who went to every site. He was a senior partner in this group. He had recovered from a serious depressive episode. He was their champion and did tremendous work on changing the attitudes and the openness. We've seen that also unravel within police environments, a high stigmatizing, predominantly male environments. As soon as you get that kind of awareness and communication from leadership, things really open up. So I think that's really one of the key parts: grassroots peer, and then the leadership to join them in the cause as well.
Thank you, Doctor. I'll say one last question, of course, is needless to say, as you rightly pointed out, the industry is actually, as much as it's male dominant, it's also opening up, especially with innovation coming along, with name it, whether it's drones or whether it's artificial intelligence. Quite a lot of young people are also, and that's one of the goals for the industry as a whole, is to attract quite a lot of young people, whether it's the millennials or the Gen Zs, to the industry. And if somebody were to Google and say, oh, suicide is quite high in construction, and maybe I don't want to go in there, something like that, how can we as an industry positively promote to attract that young audience, keeping in mind, especially in this COVID situation as well? I think quite a lot of us became aware of the stress, especially whether it's losing the job or the financial, or leave anything for that matter, to see what's going to happen next, kind of thing. In those circumstances, how do you see us as an industry progressing when we're especially talking to a younger audience itself? How do we talk to them, and is there any advice that you can help us to say how is the best way for us to communicate to them so that they actually see the positive things, rather than seeing in terms of, oh, I'm getting into a stressful environment?
Yeah, so I think you bring up, the old approach, hey, let's keep this is a dirty little secret, nobody talks about it, and then people will come in and they'll figure it out on their own. Whereas I think if a millennial, and the millennials' expectations of the workplace are much different than my generation or certainly beyond, is that the workplace has a responsibility to keep their health, to actively participate in maintaining their health. It's just the way it is. It's the new reality, and quite frankly, it's progressive. I'd say tackling this straight on. So not suppressing. So there's one is to create awareness around these issues. But if a young person entering this industry sees that, the construction industry is proactively trying to tackle these issues, making investments not just in technology and innovation, but also addressing core health issues within their industry, I don't think that's a deterrent. I think that's actually going to entice individuals from coming in, because they can see that their employer is having their best interests in mind. At the same time, having education and training as part of their apprenticeship around what are the risk factors to their mental health as they come to this industry. We've done a lot of that work within the healthcare industry, high rates of burnout, depression, anxiety, the same kind of issues, but people are being educated up front on how to take care of themselves from a work-life balance instead of working 80 hours a week. So I think this needs to be introduced in the early phases of apprenticeship and throughout, and then continuous with their employer as well. And I don't think you'll be deterring people from entering this field.
One last question, Doctor, and I'm sure this is which is going to affect all of us. Most of us think we are immune from COVID-19. When I say immune from COVID-19, I mean to say the mental stress from COVID-19. You know, we work from home, work-life balance suddenly, is something that has been stressful. How how do you see it in terms of current circumstances? How is this thing being affected overall?
Yeah, well, I was anticipating, let me just get something here. So really, when we are talking around with the COVID piece, right? You know, this is the first time I'm dealing. This is my first pandemic, unless you were born before 1918. But I think really right now we're kind of in this disillusionment phase right now, and maybe emerging somewhere around here. So I think we need to recognize that COVID has been a stress test. I know it's tested me personally, it's tested my family, it's forced me to adapt practice or the way that I work as well. But I'm also anticipating it's not over. So one of the key parts is keeping the sights set on this new beginning. So I've used a lot of goal setting is I'll react and respond in the months ahead, but I'm also think a lot about a year from now, where things are at. And that's where I see something much more prosperous and palatable from my perspective. So I think this is a time actually to be proactively reaching out to individuals you see could be at risk. So if you already have a mental health program in place, you're seeing higher rates of treatment seeking, increased utilization of psychological benefits, those parts in place. So in COVID, I would think this could be a time where you start to develop some of the awareness, and start to develop perhaps some get some training for some of the people anticipating you're going to see some follow-up with the mental health impact of COVID itself. The other factor I think is coming forward is people with pre-existing mental health issues are becoming more symptomatic because they're having difficulty accessing care, or they've reached their ability or past their resilience. The other factor is increased substance use rates that are developing through. So this might be a good time to inventory within your organization around what are the key parts that are affecting people, and then starting to work on your strategy now so that if there's a second wave or a next time there's a very substantial stressor like COVID, you actually got a strategy put in place as well. So this is an opportunity for planning, inventory and planning is really how I would approach it.
Thank you, Dr. Benda, and I'm sure that's an advice we can all take on because we are all in this, and we are not immune. We are all, when I say immune, we are not immune from the mental stress of things.
Yeah.
And I think this is a very practical and valuable advice. On behalf of the Canadian Construction Association, thank you so very much for sharing your insights, practical advice. And I'm sure this is not going to be the last session that we have on mental health, but this is going to be an ongoing conversation we as an industry would be actually having, both to educate our members and also to educate our workers as well, to say how important, and as you said, awareness is the first step. Having that champion is the first step. So thank you once again, Dr. Benda.
Super.
Thank you everybody for joining us on this call. And I'm assuming we would actually have this deck that we can share as well.
Yeah, that's fine.
Awesome. Thank you so much. And
Okay.
we will have this recording on sooner on our website as well. Thank you so much, everyone.
Thanks, Kenny, and thanks to all the attendees for your time and attention.
Thank you.